Okay, first we have to know that folk medicine is a medicine originated from primitive men's reactions or attitudes to natural events. Magic and witchcraft play an important role here. In these societies where witchcraft and religious belief were of great importance, disease and health were explained by external factors penetrating and harming the body. People's efforts to find a solution to this disease set up the basis of folk medicine. Currently, in traditional societies, opinion of disease and health were born as a part of folk culture. For these reasons, practice related to the issues are the realm of anthropology, ethnology, and sociology, while technical analysis falls under the disciplines of medicine and pharmacology.
Folklore medicine is perfectly harmonized with cultural components. In most cases, the patient either recovers or dies. If he gets well, it's believed that the method of treatment used was valid and this method becomes permanent. However, the death of the patient doesn't mean that the method of treatment method was unstable, only that the patient was beyond its scope. The main difference between the medicine modern and traditional medicine is the causes of disease. With modern medicines try to explain of causes by germ theory, and traditional medicine, which also accepts the existence of germs, explains disease by magical and supernatural events.
The traditional medicine is still present today is the sum of diagnosis and treatment which people have recourse to in underdeveloped or developing countries where modern medical facilities do not exist or because of their religious belief. The main reason for traditional medicines acceptable can be explained by the fact that belief changes very slowly. In Turkey, especially in conservative communities, we still can see samples of traditional medicine to favor them formerly. People who has methods of treatment who are known as old women in Turkey and are in fact traditional physicians.
Agricultural workers and health practice. Folk medicine is practiced by a majority of the Mexican population within Mexico, especially among the poor and usury. It is therefore no surprise that this belief surfaces and surfaces on the people and population cross international borders. There are many types of alternatives of a folk medicine practitioners among the Hispanic community.
First, there is a common culture understanding regarding spiritual and healing that foster and trust between the patient and Salvador. And second, the healthy agricultural area often result in workers suffering from occupational or workplace injuries. Herbalism, also common practice where components of plants or plants like berry, roots, leaf, etc. are used for their medical properties. A person who practices herbalism is called yerbero. Some examples of medical herbs include chamomile, manzanilla, which is taken as tea for its calming properties, aloe vera, which uses topical or to the skin to cure beetles, rashes, and eucalyptus, which uses as tea, and these alleviate and help symptoms associated with common cold.
Curanderismo is seen as a combination of the above-mentioned practice with a few other components. The practice also assumes a social network of a relative or relative who can diagnose the illness and act a curandero. Mal de ojo is defined as an illness that is inflicted due to envy, when the glances of admiration of a strong person implicit on another for too long.
Susto is defined as result from a daily or frequent occurring or shame weeks has caused the soul to temporarily leave the body. Susti is also built to be associated with depression and association with has been documented in research. The symptoms associated with it include loss of appetite and vain lack of motivation and laziness.
Understanding, diagnosing, and treating these conditions or illnesses by clinicians becomes difficult due to the difference in medical and cultural perspective that must be overcome by health center staff. Visual language and cultural barriers serving as obstacles. Use of alternative or folk medicine is difficult to determine because patients are very often afraid that healthcare professionals will judge or ridicule them for their belief systems. Many patients claim that they don't inform their doctors of alternative medicines or alternative treatments simply because their doctors don't ask about them. Patients also report that they could appreciate their doctor asking what home remedies they are using as treatment if they remain open-minded and if the doctors understood folk medicines. Healthcare staff can and could benefit from knowledge and training on Spanish traditional medicines, whether treatments or belief may differ, and awareness of the symptoms associated with the certain illnesses and curanderismo practices will facilitate the diagnosis and treatment of a sick patient.
Wow, I feel good. I knew that I wouldn't. I feel good.
First, we have to know what is dance therapy. Dance therapy is a psychotherapeutic method that emerged in the United States in the 1940s. Miriam Chase, Trudy Scoop, Lillian Ispine, Mary Whitehouse, and Hector Paz are the founders of the different modalities of dance as therapy. It is included under the term of artistic therapy since the therapy is carried out through unconventional methods such as the arts. In dance therapy, dance and movement are used for therapeutic purpose to achieve the integration of bodily, emotional, and cognitive process. For next, my classmate Caroline.
The purpose of dance therapy. The purpose of dance therapy is a process in movement in which the integration of the body and mind of the individual is sought. This is characterized by the use of the dance and movement solve people and emotional conflicts. What are the benefits of the dance therapy? Improves breathing, develops creativity and imagination, helps the management and expression of the emotions.
In dance therapy, what is so is the externalization of emotions to the awakening of the body. This is why during the session muscular tension are working. Breathing is regular to a specific exercise. Posture is correct. Volume is given to the body in space, thus finding a new way of communication.
Through dance, one does not only see the pursuit of the gesture and the beauty of the interpretation. Above all, dance therapy emphasizes expressing through movement what blocks us daily life. For dancing, we can express our fears, angers, the anguish, the pain. The moment we recognize this feeling within us, we can exercise them, bringing them to the outside through our own body so that once visualized, we can understand them and eliminate it.
It is precisely through move that change can be generated not only at the physical level but by actively working the kinetic body at the same time. That body that is not visible and do therefore if often forgotten, and that can be the cause of successive sensory and physical problems.
Dance therapy methods. Dance therapy was developed taking into account different methods. The Labian methods of variant analysis, LAM, and the movement psychodiagnostic inventory, MPI, and the Kestenberg movement profile. But dance therapy is based above all on four axes: dance technique, imitation, improvisation, and creation. These are related to each other and complement each other because through the work carried out with the dance technique, a series of movements known as necessary for improvisation and are learned. During creation, elements from the aforementioned areas are joined.
Dance technique. Through the dance technique, it is not intended to teach movement and guidance to learn to dance, but to be able to express through the movement of our inner world. Better perceive bodily feeling, expand the repertoire of movement, and pay more attention to the function between the state of mind and movement. Among its techniques, we have imitation, improvisation, and creation.
The benefits of the dance therapy. The number one is increases self-awareness, self-esteem, and personal autonomy. And the number two is experience link between thought, feeling, and action. The number three is express and handle overwhelming feeling or thoughts. And the number four is maximize communications resources.
So good, so good. I got you. Wow, I feel nice. A sugar and spice. I feel